Do you frequently feel like your heart is racing when you see a spider, even if it's tiny and harmless? Or maybe your legs tremble when standing on a balcony, even though you're perfectly safe. If yes, you might be experiencing a specific phobia. Specific phobias are intense, unreasonable fears about particular things or situations, like spiders, arachnophobia, heights, acrophobia, flying, or even needles. These aren't just normal fears. They're so strong that they make you avoid the thing completely, even if it disrupts your life. For example, someone with a fear of flying might skip a best friend's wedding across the country just to avoid a plane ride. It's like your brain hits the panic button too hard, too fast, over something that most people handle calmly. So why do some people fear spiders, while others can hold them like pets? Causes vary. Sometimes it starts with a bad experience. A childhood memory of a dog bite might lead to a fear of dogs, cynophobia. Other times, you might learn the fear by watching someone else. For instance, if your mom screams every time she sees a bug, you might grow up thinking bugs are dangerous, even if they're not. Some fears can also come from information, like hearing news about plane crashes and suddenly feeling unsafe on flights. And science shows that fear can also be partly in your genes. If your parent has a phobia, you might be more likely to develop one too. It's like a mix of your life stories, what you've seen, and even your DNA. How do you know it's a phobia and not just a small fear? Think about this. Does your body react fast and strong? Like, does your heart race, your palms sweat, or do you feel dizzy when you see the thing you fear? Maybe you go out of your way to avoid it, taking stairs every day instead of the elevator because you fear being stuck, claustrophobia. Or perhaps you can't even talk about the thing without feeling anxious. For example, someone with a fear of needles might pass out not just during shots, but even at the thought of one. These reactions happen quickly, almost automatic, last for more than 6 months, and mess with daily life, like skipping medical checkups or avoiding fun trips. Diagnosing a phobia isn't about a blood test. A doctor or therapist will simply talk to you. They might ask, what scares you? When did it start? How does it affect your life? It's like telling your story to someone who wants to help. The goal is to see if your fear fits the sign of a specific phobia and not another condition like panic disorder. The good news, treatment works well. The most popular method is called exposure therapy. It's like training your brain to stay calm. You start small, maybe looking at a picture of a spider, then watching a video, then being in the same room as one, slowly, safely. Another help is CBT, cognitive behavioral therapy, where you learn to change stressful thoughts like that spider will kill me, to calmer ones like it's small and wants to run away from me. Therapy gives you tools, like a mental seatbelt for scary moments. Can you stop a phobia before it starts? Not always, but you can reduce the chance. If a child sees a dog and gets scared, instead of saying run, it might bite. A better response is it's okay, look. It's on a leash and wagging its tail. This helps the child learn safety, instead of fear. Open talks about fears also help. For example, if your child is nervous about thunder, explain what it is in simple words and stay calm during storms. Parents, teachers, and friends play a big role by staying relaxed and supportive. Avoiding the feared thing might feel helpful short-term, but it teaches your brain that avoidance equals safety, making the fear stronger. Instead, small, brave steps with support make a big difference over time. Science is always learning more. Recent studies show that virtual reality VR therapy is becoming a game changer. Instead of waiting to find a real spider or climb a tall building, people can face their fears in a safe virtual world, like standing on a VR cliff or watching a virtual spider crawl toward them. It's like practice mode for real life. Another exciting advance is using apps that guide breathing and calming thoughts when anxiety hits. Some researchers are even exploring how quick medication boosters during therapy sessions might help the brain unlearn fear faster. These tools don't replace therapy, but make it stronger, more accessible, and less intimidating.